Hello, everybody. Hey, Dr. Sankar, how are you?
Good morning.
So, starting off the morning, it's a little early, but we have the world famous Dr. Raman Sankar from UCLA, pediatric epilepsy. Um, Dr. Sankar has been here since day one of Epilepsy Awareness Day. UCLA has supported us all along. They have been a huge inspiration as they did our daughter Sophie's brain surgery 12 years ago, and was the pretty much the inspiration for all of Epilepsy Awareness Day. We're very fortunate to have these guys here. Amazing team, and I'm going to turn it over to Dr. Sankar to do a welcome, and we'll get this thing rolling.
Thank you, Brad. Good morning, everyone. Welcome to the 2021 Epilepsy Awareness Day. Normally would have been at Disneyland, and I hope that we'll be doing that again next year as usual and be able to enjoy each other in person. At the moment, we are still, required to keep things somewhat cautious, so to speak, and do this by a virtual meeting in that format. Regardless, we hope that this would be just as informative as you go through various aspects of the program, from the exhibit areas to the presentations. We have an exciting list of presentations, and that starts with this morning. After my remarks, Dr. Samuel Ann, one of my graduating stars from our epilepsy fellowship, will be speaking about what causes epilepsy. He'll review the various reasons why children and adults end up with a seizure disorder of genetic or other causes. I will then address you at 10 o'clock after Sam's presentation to review whether a patient may or may not be a surgery candidate, what leads to the surgery candidate, and a very simple overview of the type of evaluation we do and the types of epilepsy surgery options that exist today. You will find that over the next couple of days, you're going to see some more details about it. Mine would be sort of a bird's eye view of the big picture of what we sometimes called medication-resistant epilepsy. Some of you, those of you in Orange County, know we had a special program. My adult colleague, John Stern, and myself, we actually wrote a whole book on medication-resistant epilepsy that was published last year. And so it's a very, very big topic and probably affects 1/3 of all the people with epilepsy. Then following Dr. On's presentation and mine, you'll hear from Ben Edmonds, one of our fellows. He's going to talk about something very, very practical for all the families dealing with epilepsy, and that is he's going to focus on rescue therapy. So this would be including the latest advances, of which there have been many. We have a couple of very new approaches to rescue therapy, and one more coming up probably early next year. So he's going to be reviewing all of those. And at 1 o'clock, Beck Reyes, our epilepsy clinical nurse practitioner, is going to review the ketogenic diet. Ms. Reyes actually manages all our dietary therapies outlook. She manages a clinic that guides and follows patients not only on the traditional ketogenic diet, but also on the modified Atkins, and in select cases, the low glycemic index. All of them require adherence to protocols and careful monitoring for both safety and efficacy, and she'll review those. And in terms of nuts and bolts of implementation, on the kitchen side, rather than the clinic side, we have a diet team that's going to talk to you. They'll be talking about actual implementation of the diet at home, including recipes and how that works. Then at 2 o'clock, we have Dr. Don Eliashiv, one of the professors in our adult program at UCLA, who's going to talk about neurostimulation, particularly that this is a field that, again, until a few years ago, we mostly had programs on the VNS, but now the choices have expanded, and you will hear from her about VNS as well as RNS. Then at 3 o'clock, Dr. Rajaraman, we usually just refer to him as Dr. Raj. He's going to talk to you about the Tuberous Sclerosis Center of Excellence that we run, and he is the director now of it, and he's going to talk about the overview of its activities, clinical studies, and trials available through that Center of Excellence. And at 3:30, he's going to continue because Dr. Raj has become quite involved in dealing with the multidimensional problems, neurologic, psychiatric, developmental, educational aspects of these broad neurodevelopmental disorders. And so he's going to talk at 3:30 about our CDKL5 program that he initiated last year, and it is part of a NIH-supported program. And he will talk about that unique genetic epilepsy. That is our program for today. For tomorrow, we're going to have another list of excellent presentations. Tomorrow morning at 9:45, you'll be welcomed again back to the educational block with Raquel Gallegos, our program manager at UCLA. That'll be followed at 10 o'clock by a presentation by Dr. Hiroki Nariai. He's going to talk about newly diagnosed and what to expect. And he'll be followed at 10:40 by Dr. Lekha Rao on intractable epilepsy, which, as I mentioned to you, is I'll allude to this morning as well, and she'll go into it again further. Then at noon, we have a luncheon hour talk by Dr. Arya Fala. He's the head neurosurgeon who handles all the epilepsy surgery at our program, both resective surgeries and placement of various forms of neurostimulation. At 1 o'clock, Dr. Sean Hussain will talk about the latest developments for treatment of infantile spasms. Dr. Hussain runs the extremely knowledgeable and user-friendly Infantile Spasms Project website. He heads the project, and he's going to talk about the latest treatment options. And at 2 o'clock, John Stern, my colleague and my co-author of the book on medication-resistant epilepsy, will address you regarding various aspects of adult epilepsy. That's a 1-hour presentation at 2 o'clock. He works closely with Dr. Eliashiv, who is going to address you a little bit later today. Then to sum things up, I'm going to meet you again tomorrow around 3 o'clock in the afternoon. And that'll be, it's simply called Ask Sankar. So it's left fairly wide open for you to grab any of these topics you would have heard things over, and or anything else that may not have been already covered. And I will, of course, do my best to either answer it forthrightly or indicate additional sources of information where you can get more. So that'll be our program, followed by Ms. Gallegos will come back and talk about some of the socio-political and economic aspects. Her talk is probably going to resonate with a lot of you, and that is, why is it so difficult to get my medications? So she is our high priestess who actually makes things happen after I write a prescription. Because invariably, anything new, including our new options for rescue therapy, goes into the prior authorization box that she has to deal with. And she'll talk a little bit about prior authorizations, refills, how that works with your different types of insurance, including public coverage. Okay. And she'll also explain to you how some of the pharmaceutical companies have some web pages where you may be able to find discount coupons to vouchers. Okay, so that'll be tomorrow at the conclusion of the day. So the